The axis of an EKG is the average direction of electrical movement through the heart during depolarization. Cardiac axis is generally reflected by the ventricular axis, and interpretation relies on determining the relationship between of QRS complexes of the limb leads. After the depolarization wave arrives at the AV node, it travels down the interventricular septum and begins depolarizing the ventricles. The Purkinje fibers run just below the endocardium, which is the innermost layer of the heart. Each Purkinje fiber initiates a depolarization vector that travels directly outward, from the endocardium, through the myocardium, towards the epicardium. Since depolarization waves travel very quickly, they all fire off pretty much simultaneously. When all of the individual vectors are added up, the overall resultant vector arrow represents the electrical depolarization from the AV node through the ventricles in one direction, which is called cardiac axis. Therefore, cardiac axis is reflected by the QRS complex. Normally, the cardiac axis is directed downward and to the left since the thicker left ventricular wall produces the larger vector in that direction. We can observe leads 1 and AVF to figure out the direction of the axis by quadrant method. The lead 1 moves from right to left across the heart, so any vector pointing to the left will be positive in lead 1. The direction of AVF is downward, so any vector pointing downward will be positive in AVF. If leads 1 and AVF are positive, the overall vector is pointing both down and to the left. Therefore, it directs the bottom left quadrant, which is between 0 and plus 90 degrees, and cardiac axis is normal. You can also imagine 2 thumbs pointing up, left thumb in the direction of the lead 1 and right thumb in the direction of AVF. If the QRS complex is positive in lead 1, but negative in lead AVF, the overall vector is pointing towards the left and upper quadrant, which is between 0 and minus 90 degrees. It is like left thumb points up in the direction of the lead 1, and right thumb down in the direction of AVF. It could be normal if the overall vector is between 0 and minus 30 degrees. Left axis deviation is considered when it is between minus 30 and minus 90 degrees. Then we have to look at lead 2. If the QRS complex in lead 2 is also directed downwards, there is left axis deviation. Although left axis deviation is often an age-related physiological change, it may indicate the presence of various other conditions such as left ventricular hypertrophy, where thicker left ventricular wall produces bigger vectors, inferior myocardial infarction, where the damaged or dead myocardial cells cannot depolarize resulting smaller vectors directed towards the right. Conduction abnormalities such as left bundle branch block or left anterior fascicular block can produce left axis deviation. The position of the nearby structures can also affect vectors. For example, in obese people, diaphragm gets pushed upwards, rotating the heart towards the left. If the QRS complex is negative in lead 1 and positive in lead AVF, the overall vector is pointing towards the right and lower quadrant, between plus 90 and 180 degrees. In this pattern, the left thumb points down in the direction of the lead 1 and right thumb up in the direction of AVF. It is considered right axis deviation. Right axis deviation can be caused by right ventricular hypertrophy, lateral wall myocardial infarction where the left side of the heart is damaged and loses healthy tissue, conduction defects such as right bundle branch block or left posterior fascicular block, right ventricular strain due to chronic obstructive pulmonary disease and pulmonary embolism, and dextrocardia. Finally, if QRS complexes in both leads 1 and AVF are negative, it is extreme right axis deviation or northwest axis, between minus 90 and 180 degrees. This happens when the ectopic focus causes depolarization to start from the bottom of the ventricles, traveling in northwest direction. The presence of broad QRS complex and extreme axis is a strong indicator of ventricular tachycardia. Otherwise, it is also a good idea to recheck the correct placement of limb leads. The quadrant method provides the rough estimation of cardiac axis. To be more precise, isoelectric method can be used. The lead that has equal magnitude of positive and negative deflections is called isoelectric lead. The isoelectric lead may also show flat line QRS with no discernible feature. The direction of the axis is perpendicular to that of the isoelectric lead. Memorizing the limb leads and their corresponding degrees helps in determination of cardiac axis. The lead 1 corresponds to 0 degree, the lead 2, plus 60 degrees, the lead 3, plus 120 degrees, AVR, minus 150 degrees, AVL, minus 30 degrees, and finally AVF, plus 90 degrees. The lead 1 is perpendicular to AVF, lead 2 is perpendicular to AVL, and lead 3 is perpendicular to AVR. To determine the cardiac axis by isoelectric method, find the lead that is closest to being isoelectric. In this EKG, AVL has relatively same positive and negative deflections. The cardiac axis runs perpendicular to the isoelectric lead. Therefore, cardiac axis aligns on the same line as lead 2. Since lead 2 is positive, the cardiac axis points along the direction of the lead 2, plus 60 degrees, which is normal. In this EKG, lead 2 is isoelectric. AVL is perpendicular to lead 2. Therefore, observe the polarity of AVL. A negative QRS complex in AVL points the cardiac axis towards opposite direction of AVL, which is plus 150 degrees or right axis deviation. If there is no isoelectric lead, find the most isoelectric one, and use the exact same step as described previously. If the isoelectric lead has larger R wave, adjust the axis 15 degrees towards isoelectric lead. If the isoelectric lead has larger S wave, adjust the axis 15 degrees away from the isoelectric lead. In this EKG, the lead 3 is most isoelectric, and AVR is perpendicular to lead 3. The polarity of AVR is negative, the cardiac axis points around plus 30 degrees. In lead 3, R wave has greater amplitude than S wave, the axis is 15 degrees closer to lead 3, which is 45 degrees. I hope you enjoy this video. Thank you for watching this video. Stay safe and healthy.